Welcome to the Justice Journal podcast. I'm Sacramento County District Attorney Anne Marie Schubert. I hope you enjoy this podcast series where we discuss important public safety issues and provide insight into who we are as an office and what we do both in the courtroom and in the community to provide the highest level of public safety through prosecution, prevention, and innovation. All right, welcome to the Justice Journal podcast series. We are doing a special series now on the COVID-19 pandemic that we are facing here in Sacramento, as well as across this country and across this world. I'm District Attorney Anne Marie Schubert, and today I will be hosting a special series on domestic violence during this pandemic and the impacts that it's been having on our community during this crisis, as well as during this public health stay-at-home order that we have from our public health officers. Today, we're going to talk about how domestic violence victims and their families are and continue to be served during this crisis. Today, I'm thrilled to be joined by a number of people that deal specifically with this topic in our community. First and foremost is Chief Hahn from Sacramento Police Department. We also have Beth Hassett from WEAVE, the Executive Director, Nilda Valmores, the Executive Director of My Sister's House, Faith Whitmore, the Executive Director of the Sacramento Regional Family Justice Center. And from the DA's office, I'm proud to have Assistant Chief Deputy Don Bladet, as well as our Supervising Victim Advocate for Domestic Violence, Lisa Corral. So thank you all for joining us today.
Thank you. Thank you.
All right, so let's start off just to do a little bit of background so people that are listening can understand what all of our service providers do in our community and what you're available for regular basis as well as during the pandemic. So why don't we start with you, Beth, if that's all right?
Yes, hi. WEAVE is a 42-year-old agency providing services for domestic violence victims as well as victims of sex trafficking, and we are the Rape Crisis Center for Sacramento County. Our mission is to promote healthy relationships and support victims of all of these three crimes. So we generally have a large office down in Midtown. We're providing embedded services throughout the community, and we have a large residential program providing safe emergency and transitional shelter to victims.
All right, great, thank you. I'm going to switch over to Nilda now. Can you tell us a little bit about My Sister's House and the services you provide?
Thank you for having me. My Sister's House has been around for about 20 years, almost 19 to be exact, and we help victims of domestic violence with a focus on helping Asian Pacific Islander and other underserved victims of domestic violence, sexual assaults, and human trafficking. So we provide similar services, but hopefully we provide in a culturally responsive way in terms of providing outreach and education, 24/7 multilingual helpline, shelter, and also what we call our Willing to Work program, which includes legal services, counseling, and most importantly, job training and job preparation to help survivors get back on their feet financially.
All right, great. Thanks, Nilda. All right, Faith, if you can tell us a little bit about FJC and the services you guys provide.
Thank you so much. We are a one-stop center for victims of domestic violence, elder abuse, human trafficking, sexual assault, and child abuse. And we do the work that we do because we collaborate so strongly and have that at the core of our mission with all these other wonderful groups in town and agencies. Mm-hmm. So victims can come to our center and receive wraparound services all under one roof. So we are still providing all of those services right now.
Okay. All right, let me switch off in terms of what is law enforcement doing in particular during this pandemic, and just ask you, Chief Hahn, first of all, thank you to you and your department and all of our law enforcement partners for being the first responders during this crisis. But if you can just tell us, you know, what you're seeing now, kind of boots on the ground in terms of family violence, domestic violence, and how your department is responding, and what kind of words of wisdom you would give to our community.
Yeah, thank you, District Attorney Schubert, for having us and convening this. So there's a lot of challenging things that come with a health order and significant changes to our lifestyle. But two of the most significant things that we are seeing since the health order went into effect is a significant increase in domestic violence and a significant increase in mental health related issues. And so, you know, with loss of employment in many cases, with food issues and just additional stressors placed in people's lives, these two things are some of the most significant increases we've seen. So for example, with suicide, we're up 86% in suicides compared to the last 2 years. And we average a little over 3 suicides a month in our city. And now, not even halfway through April yet, we're averaging 5 suicides a month. And some of those, unfortunately, are young people. So it's really critical to us that people contact the police department if they see domestic issues going on, domestic violence issues, or something they think could be domestic violence issues. So one, first and foremost, we can make sure people are safe. And then also on the mental health side, if people are concerned about the well-being of people and concerned about their mental state, also call us. And we work really hard to try to get victims of domestic violence into some of the services that are represented here on this call today. But first and foremost, we want to make sure they're safe. So people can always, the best thing to do if you are able is to call on the phone 911 and talk to a dispatcher. And that way we get as much information as we can as the officers respond. But we also know that people aren't always able to do that, whether they might be deaf or they might just be in a situation where they can't get on the phone. They can also text information that anywhere in Sacramento County, it will get to the appropriate law enforcement agency. And what they do is they just open up their text on their phone. And when they type in the name or the number that they would normally text to, just type in 911. And then in the text box, whatever information, your address is, and sometimes that's the situation people are in that they have to do it that way. So people can contact us either way.
So Chief, if somebody, say, lived in the city of Elk Grove and they were in a situation that they needed to text 911, would that get routed to Elk Grove Police Department or vice versa in the city of Sacramento?
Yes, and the same with a cell phone call. Back in the day, they would have to call, if they called 911 from their cell phone, it would go to the highway patrol first. Now it comes directly to the appropriate agency. And so yes, if they texted 911, it would get to Elk Grove Police Department if they are in Elk Grove.
Okay, that's great. That's a really good resource for folks to have. Okay, let me switch over to the DA's office, and I'll start with Dawn. For those of you that don't know, Dawn oversees our family violence unit in the office, and a lot of stuff has changed in the last 4 weeks, Dawn, fair to say, with the court system and how we're processing cases. Obviously, justice doesn't stop. But if you can kind of just give a general sense of what we're doing with the courts, and then maybe more in particular with domestic violence types of cases.
Sure. So the court closures have obviously had an impact on what is happening with criminal cases, but the criminal cases are still coming to the district attorney's office. We are still prosecuting abusers. We have also, as Chief Hahn pointed out, seen an increase in warrant request and in fresh arrest. So our domestic violence attorneys are working virtually and also in the office. They're reviewing these cases. They're trying to make immediate contact with the advocates, as Ms. Corral is here representing as well. We want to make sure that victims are safe. There's a few ways that we're doing that. When on site, there's an emergency protective order that can be granted by law enforcement, and the emergency orders that are in place here in California and in Sacramento County now extend that emergency order for 30 days. So that gives the victim time to be able to get to a resource like the Family Justice Center and to get a restraining order in effect. But if we know before the arraignment, which comes shortly after arrest and filing, that the victim would like a no contact order, we also are still doing those and putting those no contact orders in place in the in custody situations that we have the opportunity to do so. So the court process has definitely changed. It's slowing down. We're not going to see jury trials immediately, but in the meantime, all of the cases are still getting through the system. It's just going to be in a different way and a little bit slower, but we certainly are contacting, making sure that victims are putting safety plans in and getting protective orders where appropriate.
Okay, I want to ask you kind of a side question, because I know in the news, and we've been dealing with what's called an emergency bail schedule here in our county across California. And some people may be hearing it in the news or on social media. Can you just explain whether or not how that would or would not apply to domestic violence types of cases?
So fortunately, both the state and local officials recognize the concerning situation that is domestic violence. And so domestic violence charges, anything related to domestic violence, they are exempted from the zero bail schedule that's been imposed for a number of crimes. So they are not the kinds of cases where somebody would receive zero bail. The regular bail is intact for those offenders. They also are being, the cases are still being heard in the courts in terms of bail motions, being able to be heard by a judge, explain the danger situations, if there are lethality factors in place where we need to make certain that the no contact and protective orders are in place. So those are changes that have happened, but domestic violence has been carved out as an exception for a lot of the changes that you may be hearing about on the news with regard to people getting out of custody on their active criminal cases.
All right, well, that's definitely good to know. So, all right, thank you. So Lisa, if you can kind of tell us a little bit about victim witness and specifically how you guys are addressing kind of this pandemic and what we're doing in the court system as well.
Sure. You know, our Sacramento County District Attorney's Victim Witness Program has 18 victim advocates, but 4 are specifically assigned to the domestic violence unit. So we have 4 working in the unit. We're still able to provide advocacy and support services to domestic violence victims throughout the criminal court process. We provide crisis intervention, short-term counseling. We offer information regarding the criminal justice system and the court process and all the changes that have happened. We still can assist victims in applying to our state California Victims Compensation Board program so they can gain financial services for crime-related expenses. We still help with emergency services and so on, and we educate them about their rights. We're all working remotely right now, and a large part of our work is by phone. So we're the ones who make that initial contact with the domestic violence victim by phone, and we can discuss safety concerns, we safety plan with them, we educate them about domestic violence and the criminal justice system and the criminal court process. We offer services too. So actually, for the most part, we still continue to serve the victims, and we're still able to do that remotely. One of the biggest changes is that there's no court, for them to go to. But they now can view court live stream going onto the Sacramento County Superior Court website, and they can access preliminary hearings and view that. They can access the home court sessions going on. We even had one of our victim advocates in the homicide crime. She was on the phone with her family as they were witnessing the arraignment, which I thought was a wonderful way to still try to support your victims, not being able to be face-to-face. So we're trying to be creative in what we do. Also, the advocates actually in DV, we're all mandated reporters. So we still can stay in touch with CPS and we make our reports as needed. If we are concerned about for safety, we can still communicate with make elder abuse reports. We can still do welfare checks with law enforcement. They've been a huge help for us too if we have concerns about the victims. We can still help a victim register with Sirens, which is that notification system that the jail provides to let them know if an inmate is released. So there's continuous crisis intervention throughout the criminal court process. We can still give case updates and help them understand as we're learning the changes, help them understand the changes too. Again, we can, if a victim doesn't speak English, we can use our language line. So we can have a 3-way call and I can still interview a victim, whatever their language is, and with the assistance of language line. And the people that you have here today have been a tremendous help. And I can't tell you, I would say on a weekly basis, we are making referrals. We use WEAVE, we use my sister's house, we use the Sacramento Family Justice Center. They have been a huge help in what we do. And so I want to thank them too for being here because Anne Marie, we couldn't do what we do without them.
No doubt about that. Let me ask the service providers, WEAVE and Nilda and Faith, how are things different in terms of the operations? Are you guys doing remote things like Lisa mentioned in terms of the victim witness in our office? Beth, how about Beth, you start?
We are, we started seeing this coming on the 12th of March and started making changes. We had a full house at our emergency and transitional housing programs, so we knew that we needed to keep those locked down and continue serving those clients in person. we looked at all of our options for how to continue serving clients, and everybody thinks it sounds like a great idea to use Zoom or some of these other platforms, but they're actually not in compliance with our funding that we receive through Cal OES and the Office of Violence Against Women, because they don't meet the non-disclosure requirements that, believe it or not, are more stringent than HIPAA for us in protecting victims. So we can't do anything that actually allows people to see each other's faces, which is, it's kind of unfortunate. So everything's done on the phone, but we're still doing 40 counseling appointments per day with our counseling folks. We're still taking on new legal clients and, doing the same kinds of things you are with safety planning and helping them understand that their cases are going to be moving a lot more slowly through the system. We launched our online chat 3 weeks ago, and we are averaging about 45 chats a week, which is great. And they're long. Some of them are an hour long, going back and forth with somebody for whom it's not safe perhaps to make a phone call. So we're still doing all of those things and continuing to serve clients. We're just having to do it remotely, which is a challenge, but people are still reaching out and people still need that support. So we're very pleased to be able to continue to do that.
All right, sounds great. All right, how about you, Faith?
We are actually still open at the Family Justice Center, and people are coming in. We're following all the protocols, being extremely careful about everything, wearing masks, doing the disinfecting, etc. But we have victim advocates, case managers on site, and we also have attorneys who are constantly doing temporary restraining order applications on behalf of the clients. And so we have actually seen quite an uptick in the numbers of people coming in, also the level of danger in which we think they may be in. So it has been heartbreaking, and I'm so glad that together with WEAVE and my sister's house and the FJC folks that we can continue to serve this population that's so much so vulnerable right now, especially vulnerable.
Okay, and then how about you, Nilda, in terms of your operations? Are they different?
We definitely are doing a lot more teleconferencing, virtual contact with our clients, but we also have a skeletal staff so we are receiving clients in person also. So all the services are still being provided, from the legal to the counseling to the shelter. So there's been relatively no change in that. I mean, the biggest change is the way the office looks and following the protocols.
Right. Okay, I want to kind of move into a related topic, and I think everybody here recognizes that with the stay-at-home order, which now is going on several weeks and may go for several more, we all have our own anxiety raised because we're concerned about people becoming victims of domestic violence because they're in close quarters with people, and anxiety. Some of you mentioned anxiety, financial stress, all those things. So, I would just ask all of you, how do we as a community really come together in these times, oftentimes because sometimes victims don't want to speak for themselves, or they can't, right? They're in a situation where they don't have that ability. So, I guess my question, I'll start with you, Chief Hahn, is, what would you tell to the public or to that woman or man or whoever that happens to be in a dangerous situation? How can we help them?
Okay, yes. I think the most important thing is that, the whole saying, see something, say something, is anytime somebody sees, even if they can't fully explain it, but just something's not right, call us. Either call us or text us so we can check it out. If it turns out everything is okay, then that's good for us to all know. So I think the biggest thing that domestic violence victims and families can have is a community that surrounds them and protects them. And the first step is to call, if you think somebody's in danger, to call the police, and the officers will get there and take appropriate actions, and then we can try to get long-term help through the service providers. Mm-hmm. But first and foremost is their safety, and we want to make sure that they're okay.
All right, very good answer. How about you, Faith? What would you say?
Ditto what Chief Hahn just said, but I think it's really important as people are able to reach out to people they're concerned about. I'll go outward in. So if there's sisters or family members or neighbors who are concerned because they haven't heard from the person, to try and reach out in the safest way. Also, we've been telling people to come up with some code words. So like Beth said, if it's not a safe environment from which to call, if they can call somebody, you know, on a conversation that seems fairly routine and just say, you know, I had prunes for breakfast, and, you know, that would alert them to then call law enforcement on their behalf. It's just so important to do, you know, if we do suspect something, to reach out, because oftentimes the victim's in a place where she can't do that.
And I want to add to that. One thing we've really been encouraging people is we don't know where the abusive partner is when we're on the phone with somebody.
That's true.
And so I think assuming that the person might be overhearing the conversation you're having with the person should be your default, and not saying anything that might put your friend or family member at further risk. So I think just keeping in our minds that, you know, is it safe to talk? Are you alone? Or, you know, making sure that it's okay and that the person's going to be safe having that conversation with you is something that we're recommending to people as well. And to reach out and, I mean, use our support line. You know, call those of us who can offer safety planning and support, because it can feel really disempowering to a family member to know something's going on or suspect it, and really not have anything in their arsenal to do to help that person. So by all means, reach out to us or any of our other providers here and just ask questions and get some support from those who know more about this.
Okay. Nilda, anything else?
Yeah, I want to do a shout out to the API religious leaders and the API community leaders, especially, and other religious and community leaders, to especially check on their people, and especially those families that may be at risk, to make sure that the extra stress of the times is not showing up in their homes. And to remember too that that abuse may not just be between a husband and wife or a boyfriend and girlfriend. It might be coming from a father-in-law or mother-in-law or an uncle that's living in the house too.
Right.
And so we have to address those issues also.
All right, very good. How about from the DA's office? Dawn or Lisa?
I was going to add that, you know, my focus has always been on root causes, and I think what was mentioned earlier, depression, substance abuse, I mean, those could impact anybody. And so I think starting from yourself, your family, I talked to the victim advocates about it, you know, a safety plan just in general. I mean, we're all going through this pandemic. I think we're all feeling it in different ways. And so to always have in your cell phone just numbers, because you don't know if it's going to be you don't know if it's going to be an immediate family member, maybe a friend you were talking to. You can give them the crisis suicide hotline. You can give them one of the local domestic violence hotline numbers, just so that it's always there, just accessible, so that you could give it to someone as needed, because there's things that happen that lead to domestic violence. So you don't want to just treat domestic violence. You want to treat all the things that kind of, you know, could possibly lead you there. And so I think us remembering about the depression and substance abuse and all the different helps that we could kind of put in our arsenal, like Faith said, to kind of help everyone that we talk to, because we're all going through this pandemic together.
There. Dawn? Anything
That's
else?
great advice, as is the theme that you heard here, reaching out, keeping connections in whatever way you can. Make sure that you're checking in on your neighbor, doing drive-by from the street, whatever way. It may not be virtual. It may be hard for these folks to be able to get access to a computer or have time alone in order to speak to somebody. But if we're all doing our part to check in on friends and family and neighbors and make sure that everyone's doing okay, it helps us in terms of a health check, and it helps your neighbors as well.
The only other thing I would add, that and probably this is because I have kids, is that, you know, it seems to me, given that, the health order, the somewhat of isolation, that people are relying much more on their phones and their social media to communicate with folks. So I would suspect that if somebody's in a situation and they're concerned about, calling or texting, perhaps they can turn to social media, using things that have messaging, so they can message people if they need help, in addition to whether it's calling 911 or texting. But people just have to think outside the box on how they think they can get help and not put themselves in harm's way, I would assume. So, the one thing I just want to leave it with, I think everyone and Chief Hahn kind of said it, to me, this is a community need. We need to all be in this together. We need to look out for our neighbors and our friends and our family. And some of the things that we've kind of thought about are you have to be willing to hear things. You have to see it. If you suspect it, you have to report it. And that's how I think all of us, we work on a daily basis, right? But we have to encourage our community that we have to be in this together, because sometimes people don't have the ability to protect themselves. I do know that we have some resources that you all have helped us put together. I'm not sure, but I think we're going to put that up for folks to see, and then we're going to be handing it out. But again, the message is, what we're going to do at the end of this is we're going to share this podcast Zoom. We're going to ask that all of you share it with your folks, as well as the resource page, that you always go on to people's, if you have the ability to go to their websites. With our office, you can always reach out to our website. You can look at our social media platforms. And again, I would ask all of you, when this goes out, that you do the same and share it with people, because the best way we can protect people is informing them of what their options are. I just want to thank you all for being participants in this really important podcast today. We will, in the immediate future, we're going to have some specialized podcasts with each of our service providers. So with WEAVE, Family Justice Center, My Sister's House, as well as law enforcement, to kind of get into the deeper issues that each of your organizations can provide to our community, so that we can get, again, more information out to people in our community, so they can get the help that they need. So anything else that I'm missing? I just really appreciate your willingness to participate in this podcast. No? All right, you guys, listen, stay safe and healthy, all right? Thank you so much.
Thank you so much. Thank you.
All right, see ya.
Bye.
Thank you for listening, and I hope you enjoyed this episode. You can find all of the Justice Journal podcasts on our website at sacda.org, iTunes, Google Play, and YouTube.